Okay. Good timing. All right.
Oh.
So, top question on. Oh yeah, just go to town. That's Wet Willie.
Mocha, come here. Come here. Mocha, come here. Come here.
She's like, this guy lets me lick him.
Yeah.
And just stays there.
Maybe she'll listen to this. Mocha, come. Come.
Oh, there we go. Okay, so I typed in on Google and I typed in what do physical therapists do, and these are the ones that popped up. So Google search kind of like very similar to like kind of just like top searches.
Okay.
First one's just top what do physical therapists do, and then end blank is on a daily basis.
Okay.
So what do physical therapists do on a daily basis?
Well, this physical therapist plays with puppies. Well, it depends. So, like, you've got orthopedic physical therapists, you've got neuro physical therapists, you've got pelvic health, you've got geriatric, you've got acute care, home health. Lots of different types of therapists do a lot of different things. So, depends on the setting that you're in. In my setting, I typically. Oh gosh, what was that? That was sharp. What'd you get there?
What is that?
Oh, like a little.
Oh, from one of the wires or something.
This is what physical therapy is. So the main thing that like an orthopedic physical therapist does is evaluating an injury, sometimes evaluating somebody who's having some amount of pain, seeing if we can determine what the source is, and more importantly, what to do about it. Because sometimes the source isn't always there. Or it's not always knowable. So figuring out how to pave a path forward for somebody to get them to where they want to be. So if that's returning to like running or hiking or something else, that's what our focus is in the field of orthopedics, is just getting people back to functioning at the level that they want to function. Yeah. Just watching my dog.
That's crazy. That's like the first one too. Like just on Google, like the first thing you type in on like Google is what do physical therapists do on a daily basis. That's the first one.
I guess, and I guess to get on a daily basis, okay, that's like asking, well, what does the day-to-day look like? Let's see. Well, for me, it's a little different. So like, since this is my business, there's like a lot more that goes into it. But if it's just with like the patient care side of things, then she's looking your eye. Wow, look at that.
You're really into this podcast.
If she is, or she, talking about the dog now. I got puppy brain apparently. So on the day-to-day, like, if I'm seeing a patient, I'm going to review their chart. I'm going to be making phone calls to current and past clients, just to check in, see how they're doing. And then during the session with clients, I'm going to make sure that I'm taking into account, what caused the issue that they're having, what's made it better, what makes it worse. So asking lots of questions so I can get to know them, what's important to them. And then, sometimes we'll do manual therapy. More often than not, we'll do some form of exercise. And then we create a plan together to get it done. So that's really what it looks like on a daily basis. I'm helping people to exercise, helping people make sense of what they're going through, and helping them pave a path forward.
Here's the second one is what do physical therapists do in hospitals?
Ooh, in hospitals. So it's, again, variable depending on what they're doing in a hospital. My first rotation was in a hospital when I was in physical therapy school. So the day-to-day was, you're working with a variety of patient populations. So I was working with people who had just had open heart surgery. Some had just had spine surgery. Some had just had hip surgery. Some it was they were just like they had gotten really sick and deconditioned. Hey, Mocha.
No.
Stop. You just gotta really dangle in front of her and get her confused. Oh, don't drop it. Yeah. So the main thing was, we're helping people get up out of bed. We're helping them transfer from bed to the chair. We're helping them walk. Usually in the hospital, it's much lower level because people are either really sick or recovering from surgery. So you're really just trying to like make sure that they're not getting, bed sores. They're maintaining a certain amount of muscle mass. They're maintaining a certain amount of cardiovascular endurance. So making sure that their lungs and their heart is staying as conditioned as it can be in that environment. So and then there are wound care therapists also. So that's definitely something as well.
Yeah, I've seen some wound care. That's definitely.
Yeah, there's some PTs that do wound care as well.
Yeah, I could not do that. Like,
I wanted to do that at one point.
Really?
Like, I thought that's what I wanted to do, was like blend wound care and orthopedics. Wow. But then as I got into it more, I was like, nah, I'm good.
Yeah. I mean, definitely tops of people who can do it.
Yeah.
They are totally like devoted to doing it, but it's not meant for everybody.
Yeah, I'm like, I was more, I think I was more drawn to the idea that, I could like help people heal these wounds.
Yeah.
And now it's like, not so much, not my thing anymore.
Yeah.
Yeah.
It's cool to see.
Yeah, no, I mean, it's definitely needed. Like, it's a very important part of the profession and just helping people who do have different types of wounds.
Yeah.
So you've got wound care nurses, and then you also have wound care therapists.
Yeah. That's cool. All right, here's the third one. What do physical therapists do for lower back pain?
Oh. Well, I wish it was all the same. I wish that we all had a better, that we all just did things in a way that made sense and that we didn't all just say different things, because everyone's all confused about, like, everyone gets like 20 different things of what they should be doing or shouldn't be doing, or sit this way, sit that way, take this medication, take that medication, do this exercise, do that exercise. It's like once people have gotten to me, usually they've heard like 20 different things, and so I'm just another opinion at that point. But what physical therapists should be doing for lower back pain is, number one, doing a thorough evaluation, making sure it's nothing dangerous. So something that doesn't require like a surgical procedure or more medical intervention, right? So making sure that that's ruled out. So screening out red flags. And then a big part is reassuring your patient or your client that with the proper movement for them, which it's going to be different for everyone, getting people back to moving, trying to reduce the symptoms as much as possible with different types of modalities. So whether they're using heat or ice or some other type of modality to have some more short-term pain relief, like, that's valuable. And then just continual reassurance and progression. So, if somebody's trying to get back to running and they have back pain, that might be, you're going to probably do higher level exercises with them to make sure that they're able to do that, versus somebody who just wants to, be able to garden. Right?
Yeah.
I'm not saying like I'm not saying that gardening is not valuable. I'm just saying like the intensity level is higher with running versus gardening. So you don't need to like necessarily have somebody start running who just wants to garden.
Yeah. So you can basically help anybody from like an athlete to a child to maybe an elderly person. You help kind of like all different age ranges for lower back pain? Yeah,
for them. I mean, I don't work with a lot of kids. Okay. I will say that like the youngest I usually work with is like 16.
Okay.
But yeah, I mean, I've had people of all ages from the age of 16 all the way up to 90 years old.
Wow.
Like, come in here for different back issues.
Yeah.
And I've had people who've had 2 back surgeries. I've had people who've had 8 injections. Like, I've had lots of different people come in, and it's amazing to see the results that people can have when they actually get a like custom plan and they start to actually trust in their body again. I think that's a big part of the rehab process for back pain, is actually like having confidence and trusting that your body can do the things you're asking of it.